Hello everyone and welcome. My name is Tom Nelson and this is a video lesson series on resolving cholesterol issues naturally. This is the introduction. In April of 2016, CNN reported that over 1 billion people worldwide suffer from cardiovascular disease. They say that it causes 18 million deaths globally every year. Ethnicity is a critical factor, your genetics. African Americans, or in other parts of the world, Negroes or blacks, Hispanics, American Indians, are all significantly at a much greater risk than others, and the same is true with women. The American Heart Association labels all diabetics as having heart disease, despite the fact that many have never suffered a heart attack or a stroke. But 85% of all diabetics die of a heart attack or a stroke. You realize that that's approaching 9 out of 10. That's huge. Statin drugs are usually prescribed to lower the cholesterol levels. Recent changes in the recommendations for taking the statins for treating cholesterol increased the eligibility for those taking the statins. This has been just a couple of years ago. It increased the number of people taking statin drugs from 40 million to 60 million people. Critics claim that less than 2% of those that are taking those statin drugs actually are at risk and actually even need that cholesterol medication. And the side effects of statins can be very serious, including cataracts, elevated glucose, just to name a few. And elevated glucose is hardly anything that a diabetic needs. So doctors will always lean towards prescribing medications just to ensure that their patients are protected. So doctors consider other risk factors in the process, like age, blood pressure, besides just the cholesterol levels, but generally they will rule on the safe side. Doctors are trained to match symptoms with medications. But this brings up a critical factor. The symptoms are caused by your dietary and your lifestyle practices. What you eat and what you've eaten right up to this moment is who you are and what kind of medical issues you have. Your doctor bases his or her diagnosis on what the symptoms are at the exact moment that you or another patient is standing before them. An elevated cholesterol level is, of course, a major symptom, and many doctors will write a prescription even if the cholesterol level is only slightly above the current limit. So your doctor is actually medicating you for the results that he sees in your symptoms, in your blood tests, due to mostly your dietary and your lifestyle choices. This means that you really can avoid a lot of this if you eat correctly. You just have to learn how. So you are taking medications to offset all of the mistakes that you're unknowingly making in your diet, especially, and your lifestyle. In some cases, you may be taking medications that you actually don't even need, and cholesterol medications are very high on that list. That means that it's entirely possible that if you are taking dosages for other things, other medications, that you may be taking dosages that are much higher than you actually need, or you may be taking medications that you don't even need because of your diet and your lifestyle. Bottom line, your doctor is enabling you by medically correcting for your mistakes. So this is especially true for diabetics. Your doctor does not have the time, nor does he have the training to coach you on how to eat right and what your lifestyle changes should be. But he really couldn't if he wanted, because doctors have virtually no training in nutrition whatsoever. There are a number of dietary and lifestyle factors that will cause your cholesterol to rise, and you can correct them, and it's not all that complicated. But now there's new research that is telling us that everything our doctor is using to evaluate our current cholesterol risk is flawed. They now have identified 3 forms of HDL cholesterol instead of just the one that you're normally familiar with, and the same is true with the LDL cholesterol. There are now 2 forms. One of them is extremely dangerous, the other one is totally useless. But some are harmless, others are deadly. So our current blood tests group all 5 of these together, good and bad, as a single value. So there really is no way of knowing how much of any of those you actually really have. Other studies show that the current blood tests understate the LDL cholesterol by as much as 25%. The LDL cholesterol is not counted. It's calculated. They use a formula called the Wold formula. In the Wold formula, they take the total cholesterol, they subtract the HDL and the triglycerides, they divide by 5, and come up with a guesstimate of what your LDL cholesterol is. And now these university studies are saying that that is totally wrong. It's understating. So this video lesson is going to identify and explain those new forms of LDL and HDL cholesterol. You're going to learn which ones are safe and which ones are dangerous. And you're also going to learn how to minimize the bad forms of it. Then you're going to learn which dietary errors are currently adding to your LDL cholesterol level. They will surprise you. Finally, you're going to learn how to correct those dietary and lifestyle errors. So as a bonus, you're also going to learn about an enzyme supplement that you can take every single day, and it will totally remove all of the plaque from your arteries, every single one of them. I've seen it done in hundreds and hundreds of people, and I've done it on myself. You can potentially lower your blood pressure and totally eliminate your risk of developing a heart disease. If there's no plaque there to break loose and travel and plug blood vessels in your heart muscle or in your brain, there's no way that you're going to suffer a heart attack or a stroke if there isn't any plaque in your arteries. So this is of particular importance for diabetics. So now proceed to part 1, and you're going to learn about this new cholesterol research that I spoke about. Thank you, and please share this information with your friends and your family. Thank you.